Good evening, and welcome to the telephone town hall. I'm your County Supervisor, John Leopold, and I want to thank you for taking your time to attend this meeting that we're hosting while we can't meet in public. I just want to fill you in on a couple different things. The health officer, Dr. Gail Newell, has announced that the beach order that had closed all of our beaches and parks will be lifted tomorrow. That she's going to be looking very closely at what the reaction is and whether crowds can be controlled, but right now does not expect to put that back in place if people can observe the physical distance requirements and we don't have problems in any of the sites. We are also working to figure out or set up all the alternative care sites as well as new shelters throughout the community. With the Santa Cruz Vets Hall and the Watsonville Vets Hall are now set up to house people. We are expecting 35 trailers from the state in the next week or 10 days. We're looking for the appropriate location to set those up. And we're looking at a number of different systems set up to make sure that we can manage what's going on with our healthcare system. Tonight we are fortunate to have Dr. David Ghilarducci with us. He is the county's Emergency Management Services Medical Director, and he's also the president of the Emergency Medical Directors Association of California. So he is involved in planning our response here in our local medical system in Santa Cruz County, but also part of the group that's talking about what's going on at the state. I want to welcome Dr. Ghilarducci, and if you could just tell us a little bit about yourself, what you're working on and what you're seeing, and then we'll open it up for questions. Good evening.
Well, good evening, Supervisor Leopold, and good evening to District 1. Thank you for having me on. Just briefly, I have been I'm an emergency physician, but I've been the EMS medical director here in Santa Cruz for about 5 years. Before that, Santa Clara County, and way before that, and before medical school, I was a firefighter and fire captain here in the county. So a long-time resident. I've been transitioned from my traditional role of the EMS medical director and also working as the deputy health officer during this crisis that we're going through, and we've subdivided some of our duties. Dr. Newell, of course, is the health officer, and all the orders come from her. She has been mostly dealing with some of the public health aspects, obviously the beach closures, the shelter-in-place orders, the recommendations on facial coverings and so forth. My role has been primarily dealing with surge planning with hospitals and also with EMS response so that we're ready for the peak when it comes. So that's probably a good enough introduction, Supervisor Leopold.
Doctor, if you could just tell us a little bit about what you're seeing out there right now in our hospital system, our preparations, and what we might expect in the coming weeks.
Of course. So right now we are at 96 cases. It's about 53% female, primarily affecting the kind of 18 to 64-year-old age group. Obviously, those who are older are a little bit higher risk, but we know that those who are younger are at risk as well. There's clearly person-to-person and community-acquired transmission in the county. This is no longer a travel-related crisis. I think most of you know that. We can say that right now our hospitals are having a lower than average daily census, and we're seeing some small upticks, but the surge that we expected in the hospitals has not yet occurred, and that's largely thanks to Dr. Newell's order, a relatively early order to do the shelter in place. And I think credit really goes to the citizens of Santa Cruz County who have been responsive to that, who have been diligent in following those orders, and we've really reduce the transmission within our county. And so we're proud to say that Santa Cruz County, amongst all California counties, has one of the longest doubling times. And just a little bit about what doubling time means. Doubling time is the number of days between when the cases double. So if you started at 100 cases and they doubled in 3 days to 200, that would be a doubling time of 3 days. Our doubling time is 8 or even probably 9 to 10 days at this point, and largely thanks to the efforts that all of you have been making in reducing the spread. So we originally thought we were maybe 2 weeks behind Santa Clara, or maybe 3 or 4 weeks behind New York, and it's finding that we probably have more time than we thought. So what does that mean? That means the peak is still yet to come. And we expect that peak to probably happen mid-May, probably more likely late May, maybe even early June. And that's actually a good thing, because although the peak is delayed, the height or the degree of the peak will be lower. And that's super important in our county, because we have relatively limited healthcare facilities here. We have just 2 hospitals, and there's also the Sutter facility that has some capacity. And we could easily overrun those finite resources if the peak was too high. We still, of course, we're planning on the surge exceeding our capacity. We hope that it doesn't, but we're planning for when it does, or if it does. And that includes things like alternate care sites and expanding surge capacity within the hospitals. We're doing quite a bit of work with our skilled nursing facilities to get them ready, and quite a bit of work with the pre-hospital folks in protecting them and having a kind of modified response plan for when things get really crazy like we've been seeing in New York. Is there anything else? Would you like me to go on?
No, David, that's fine. We'll start taking questions from folks. So as a reminder, *41 will raise your hand if you have a question, *41, and *42 would lower your hand if somebody asks your question and you don't need to ask the same question twice. So *41 to raise your hand if you have a question, and *42 to lower your hand. And then you'll hear.
Thank you, David. I had just muted myself. You'll hear a voice saying that you've been unmuted when it comes time for you to ask a question. I apologize for not saying that earlier. I just want to ask one more quick question to the doctor, why people hit the *41 for their questions. We got a question about whether the virus that we're seeing here on the West Coast is the same kind of virus as they're seeing in New York City, or are they different viruses?
Yeah, it is the same virus, but this is an RNA virus, which means that it can probably mutate more rapidly than we would see with other types of viruses. So we're already seeing multiple different strains of this virus. And the New York virus has primarily, at least some studies have shown, it primarily come from Europe. And in the Bay Area, it's been a little bit different. The genomic studies that have been done here show kind of a variety of places. There was, one that was tied to a meeting in New York that was brought back here. Others, and that was probably originated in Europe. Others have come from Asia, from China, and elsewhere. And I think it's probably just a reminder of what an international place that we live in, and the people that work here and live here and the travel that they do. So no one particular place here for the Bay Area, kind of a variety of sources.
Great. Well, thank you very much. Why don't we take the first question from someone on the line?
Yep. Let me just
hello.
The next person.
Yeah, the next person.
Hello.
Hi. If you could just give us your name and just ask your question.
Thank you. My name's Becky. I have 3 questions.
Well, let's try to ask one question because I want to make sure everybody gets a chance to ask questions. Go ahead, Becky.
Oh, sorry, she got muted. Hold on.
Am I back on?
Yes.
You're back on. Sorry about that, Becky. If you could ask just one question because I want to make sure to get to as many people's questions.
All right. Why are we not setting up using the county fairgrounds for our alternate care sites?
That's a great question. Thank you, Becky.
You're welcome.
Yes, sorry. Thank you. Great question. We actually had looked at the fairgrounds. There were a couple limitations with the fairgrounds. It's got a lot of space, and that's one great thing about it. We found another site that actually has better sort of kitchen facilities and bathroom facilities. The other thing is the fairgrounds are being used or plan to be used for food distribution and some other things. The location of the fairgrounds is a little bit remote, but we could have overcome that. But it was definitely on the list of places to go. Right now we're looking at the alternate care site up at 1440 Multiversity, which some of you may know is the old Bethany College site. And it's a beautiful facility. They've been very generous in opening up their facility to us. It has, more bathroom facilities. There's shower facilities. There's an excellent kitchen there. They're going to be preparing meals for our patients that'll be there. So, on balance, it looks like that's the better choice.
Great. Now, if you want to ask a question, just hit star 41. Star 41 to raise your hand to ask a question, and if someone answers your question, you can hit star 42, and we'll lower your hand. We won't call on you. If there's another question, please. Good evening. Hello.
Can you hear me?
Yeah, we can hear you.
Hello. Hey,
hello.
Great. My question. My name is Jerry. I live in SoCal. My question has to do with our homeless population. Can you describe the status of the homeless population now, and what measures are being taken to protect them from developing infection and passing it on to each other and the general population? Thanks.
Thank you, Gary. Also, another great question. Obviously, that is a very vulnerable population, and we have done a number of measures to both prevent infection and to provide housing situations and means for them to isolate if they do test positive. One of the major efforts with respect to housing has to do with Project Room Key. This is a statewide project that we're implementing here. That means that we've leased a hotel where people who don't otherwise have a place to live could stay and recuperate without exposing others. And so we think that's a very useful model for doing this. It probably does not meet the entire needs of our homeless population in the county, and there are shelters and so forth that have been set up. We know that some people are more amenable to using shelters than others, and so we have outreach efforts that are trying to reach those that may be resistant to that kind of setting in ways of helping to protect them. The primary thing is really hand washing, and so it's providing restroom facilities, hand washing facilities. Some cloth facial covering is being provided through volunteers, but it's kind of in short a multi-pronged effort to address that issue.
Doctor, before we get to the next question, I wanted to ask you, there's a lot of concern about whether we have enough equipment to be able to meet the needs. And people ask, do we have ventilators? Will we have enough? What's your thought or current thinking about this here in Santa Cruz?
Yeah, it's a great question, Supervisor Leopold. There, ICU capacity and ventilator capacity is, the hospitals would typically have enough capacity to handle sort of normal business in our county. And so when those facilities are full, then we have the option of transferring patients to larger hospitals over in Santa Clara County or even down to Salinas for trauma patients and so forth. We don't expect that sort of process to be useful going forward. They're going to be just as full as us. So this is the part I probably worry about the most, is that our ICU capacity right now is limited to probably around 49 spaces or 49 ventilators. And that is after a lot of work from both hospitals to expand that capacity. Normally, Dominican, for example, has 16 ICU beds available, and that's fine in a normal situation. But they've expanded; they've more than doubled that number, which I think is just remarkable. Watsonville is making some similar efforts as well. But that said, the model projections that we're looking at suggest to us that we may need up to 100 ICU beds at the time of peak. And obviously, we don't have that capacity. So I'm very worried about those patients. We're exploring ways to expand that capacity. There are things called, we can get extra ventilators. We have some disposable ventilators. These are kind of one-time use things that can be a kind of stopgap measure. But ventilators are only part of the issue. The other part is having the medical people to manage those ventilators. And a patient that's on a ventilator requires intensive care by definition. And that means lots of nursing care, specialist physicians, infectious disease doctors, pulmonologists, respiratory therapists, and then the care, the amount of time that somebody is on a ventilator could be up to 2 weeks. So capacity is certainly an issue. Ventilators are part of it. People are the other big part of it.
Yeah, that's very important. I want to make sure to get to people's questions. If you have one, you could just hit star 41. Why don't we get the next question from the public?
Hello. My question is related to the equipment shortage in the county, specifically personal protective equipment. My mom is 91. She's an in-home support service recipient, and her provider has not been able to get PPEs, masks, or hand sanitizer for about a week. And the county says that it'll be about a month before they get those supplies. Can you speak to that? Is there a way? It seems to me that that's already determined to be a pretty vulnerable population, and many of the providers many of the healthcare providers are also vulnerable. What can we do to get the equipment for them?
Yeah, excellent question, and I have to say that I've been living PPE for the last couple of weeks, and I just want to make an editorial comment. I never imagined as a physician that we would be in this situation where we're having to make our own masks and reuse masks. There wasn't that long ago that if I was reusing a mask from patient to patient, that I would probably be in trouble with my infection control officer in the hospital. But now that's an expectation. So it's extraordinary times. I can tell you that we are doing our best to distribute the limited amount of PPE that we have available. We've categorized people who come in contact with others. Basically the two large categories are healthcare providers, and the other category would be caregivers or others that are coming in contact with people that are not necessarily in a medical care setting. And most of you have probably heard about N95s. You probably had never heard of an N95 before this happened. But N95s are the limited supply that we have. We're reserving those for healthcare workers. They're really intended for people that get close to patients, that are, listening with a stethoscope, that are putting breathing tubes in, that are doing procedures that can cause virus to kind of fly into the air. And so we've had to limit those masks to that group. For caregivers, like in-home health support services people and others, we do have a distribution plan for them. What we really need, more so than ever, are the simple surgical masks or procedure masks. And those, strangely enough, much simpler than an N95, but also in much shorter supply. When I make an order with the state, I'll order, based on requests that we're getting, I'll order, a certain amount, and I typically get about 10% in return. So there's like a 1 to 10 ratio in terms of what I order and what we receive. So it's a scarcity issue, and we're advising that if you're not a healthcare provider and you do have N95s, that you please donate those so they can be used for the healthcare providers. If you're in a public-facing occupation, like a caregiver who's not necessarily providing direct medical care, then we ask that you, use a cloth facial mask. Mostly the idea behind the cloth mask or cloth facial covering, I should say, I shouldn't use the word mask in that setting, is primarily to protect, people like your mother. I think what's more likely here, especially somebody who's staying at home like your mother, it's more likely that the virus will be brought into them rather than the virus being transmitted from them to the caregiver. And so source control is key here, and a facial covering of some sort for the healthcare providers or the in-home care persons is super important. So at this point, we will be distributing. We do not store any PPE in our warehouse. Once it comes in, it gets redistributed out. It does no good sitting on pallets in our warehouse. I can assure you of that. But we are asking people to use these PPE preservation strategies, these reuse strategies. Using homemade facial coverings is a big part of this. So it's kind of a multi-pronged event, but it's really, I think, remarkable and frustrating that we even have to face this issue.
I just want to add that a member of my staff, Angela Chestnut, is working with various sewing circles and quilter groups to collect cloth coverings to distribute them to in-home supportive service workers and their clients. As well as the state has agreed to provide some masks, and we're waiting for that delivery. The In-Home Supportive Service Workers Union, SEIU 2015, has been working at the state level to get the state to release some masks so we can use them here. So it's a multi-part plan. The Pajaro Valley Quilters Club is also working on sewing masks, and we're trying to get them out to people as quickly as possible. Let's get another question. If you want to ask one, just hit star 41. Star 41. But let's get another question. Good evening.
The wireless caller for 0072, the last 4 digits.
Are you there? If your number ends with 0072. All right, well, why don't we try another one then?
Yeah, sure.
Hello.
Hold on. All right. Next person has been unmuted.
Hi, are you there?
This is to the wireless caller 239-3724.
Yes, thank you. My name is Dawn. I have a question, specifically the PPEs. Do we have 5 days supply, 15, 30 days? Can you give me a number there? You kind of talked, but you weren't specific.
Oh. Yeah, of course, Don. Yeah, I'm afraid there isn't one answer. There's 6 different categories of PPE, from different types of masks, face shields, gowns, gloves, etc. But I can tell you that overall, we probably have, at least what we're receiving and distributing, we probably have maybe about a week's supply of N95s. The procedure masks are in very short supply. There's a high demand for those. We're doing okay on gloves. There are some local sources for face shields. They're like a Lexan shield that some of the local companies are actually stamping out and making for us. And the gowns, strangely enough, are also in very short supply. So the short answer is, for some items we have a few days supply, maybe up to a week. On others, we're actually in a deficit at this point.
Great. If you want to ask a question, just hit star 41, and if someone asks your question, you can hit star 42. Let's hear from another caller. Hello.
We're trying caller 204-0072. You raised your hand.
Hello.
Okay,
you might need to.
They might have muted their phone, and they don't realize that they muted their phone. So I'm going to mute them again.
Yeah, you might want to just check to make sure you unmute your phone. Even I've done that.
We'll try that.
Are you there?
We'll try the next person for now.
Yeah.
The next person, 239-3724.
Thank you. Yes, this is Don again. You mentioned earlier the surge capacity for ICU beds and respirators at about 49, but there might be at the peak necessary to have 100. Where would the extra 50 people go if we did exceed the 49 capacity?
Yeah, that's a great question.
And it's the question.
I do, yeah. What do we do for the 50 that we don't have space for? Correct? Yeah, thank you, Don. So, yeah, this is a very tricky question, and this is a conversation that I've had with the healthcare providers in the county, and this has happened in New York, that there have been strategies to prioritize ventilators, and it's very ethically fraught, and any system that does that has to be completely fair and completely transparent. It should not have anything to do with socioeconomic status or racial status or anything like that. That is absolutely forbidden. But doctors may be faced with choices with somebody who may be severely ill and who may have not a very good prognosis when they come in, and they may have to decide that they don't use a ventilator on that person. I'm hoping we don't come to that situation, but there are medical ethicists that have looked at this, and our plan at this point, if this does happen, is that we will look high and low wherever we can across the state or even other states to get patients to care that might be available if it's not available here. So that means long transportations, it means aircraft, it means helicopter flights, it means maybe an airplane flight somewhere. We'll do everything we can. But our process is to reach out to our partners in other counties to look for those resources.
And this is a good opportunity to stress the importance of why we have the shelter-in-place order out there and why it's important to have physical distancing because when we flatten the curve, that means that it's more likely that we'll be able to meet the needs of people who end up in the hospital if we don't have a great peak all at one time. And that continues to be our efforts, and we're very thankful for the large number of people in Santa Cruz County who've been following that order. And over time, as we can be assured that we have everything in place, there will be some changes to that order. But right now, there's a shelter in place, and it's important that people follow that physical distancing. Why don't we take another question? If you want to ask a question, it's star 41.
Hello.
Oh, hello. What's your name and what's your question?
Yeah, hi. My name is Linda, and I have a question that is related to availability of ventilators. My question is, how is the county working with other entities, for example, hospice and our medical providers, to ensure that people understand that using ventilators is mechanical life support, and a lot of people have already said they don't want to have that sort of life support at the potentially end of their life. And I think helping people understand that this is part of the situation we're in would be useful.
Well, I'm so glad that you brought that up. Yeah, thank you. And I've buried my nose in medical journals over the past month looking at this issue. And what I found was a common theme that as healthcare providers, one of the first things we should do is ask the patient what their wishes are. And there is actually a means to do this ahead of time, and I would recommend this to anybody who's ever contemplated being on a ventilator and what that entails. There are quite a few people that would never want to be, but they may not be in a position to express their wishes when a medical emergency happens. And so there is something called an advance directive. Some of you may know this as what's called a POLST form, a POLST. I would recommend you look that up online. It's a form that's used throughout the state of California. It's a form that you can print out and you can express your wishes on there. It's pretty self-explanatory. It typically requires a witness, often a physician signature, but that's not absolutely necessary. So that is a very important part. And what these journals have noted is that that often people will express their wishes and not want to be on a ventilator. So certainly we wouldn't want to deny somebody else who may wish to be on a ventilator if that's the case.
Great question. Thank you very much. Star 41 if you want to ask a question, and star 42 if your question has been answered. Why don't we take another call and a question?
Hello, can you hear me again?
Yeah.
Hello.
What's your name and what's your question?
My name is Gary, and I have a question about the nature of spreading the disease through the droplets or aerosolized things that come out when people breathe and sneeze. And I was wondering if the likelihood that the disease could be spread by an asymptomatic carrier when they're exercising heavily, say somebody's running, breathing heavily, and they pass close by other people, would they be leaving a trail of aerosolized droplets that others could inhale and possibly become infected?
That's a great question, Gary. So there's some question about how aerosolized this virus is. Typically, we believe that the greatest risk is when the virus is embedded in a droplet. So that would be more of a cough or a sneeze kind of situation. Somebody simply breathing on you probably would not be enough virus to transmit, especially in an open air environment, like say, you're walking on East Cliff and you pass each other and they're jogging and you're jogging the other way or something like that. That said, we do continue to recommend that a facial covering, a cloth facial mask, is will go a very long way to contain any droplets that may come out. Just to put it in perspective, though, and the CDC has given us this recommendation, is that while we recommend a 6-foot separation, and that's important, it may not be enough for somebody who's sneezing and they could propel, droplets a longer distance. But we also know that that you're in very low risk if you're even within that 6-foot buffer for a short period of time, typically classified as 10 minutes or less. So even being in the same elevator with somebody for just a few minutes is probably a very low risk. Of course, if that person is coughing or sneezing, they're not covering their cough, then that's an issue. Probably the most sort of frequent means of catching this virus is from your hand to your mouth. So hand washing sounds so kind of pedestrian and low tech, but it actually is probably the most effective way to prevent the spread. So, when you touch, a high touch surface like a handrail, a doorknob, and so forth, and then you touch your face, even rubbing your eyes could be enough to transmit the virus to you. So be very careful about hand washing. Sanitizer is helpful, but not a substitute for good old soap and water. And so I wouldn't be too concerned about passing somebody on a sidewalk or something like that. I would be more concerned if you didn't have, access to hand washing facilities before you touch yourself.
Thanks. Really appreciate that. If you have a question, you can hit star 41. Why don't we try to get to another person?
Hello.
Hi. Your name and your question. Hello.
I'm Cheryl, and hello. Can you hear me?
Yeah, we can hear you. We can hear you.
Okay, good. Okay, good. I'm in one of the forested areas. There's often the smell of wood burning. And I also read that coronavirus is worsened significantly by pollution. I was wondering if you had thought of banning these practices. For example, today there was quite a bit of smoke, and it was from a location pretty far away. It also prevents people from reporting fires because there's usually this background of smoke. The other thing is, how did we end up in the situation where we have like the lowest number of ICU beds in the nation? I just don't understand it for a county like this. I grew up in a very modest income county, and they have 48 ICU beds for 100,000 people, and we only had 5 to 6. I'm glad you're ramping up, but I just don't understand how this happened. Right, thanks.
Okay, thank you very much. Doctor, you could take the second question first, or the first question, whatever you want to cover.
Yeah, I'm happy. Let me start with the second question, Cheryl. Thank you for that. The number of ICU beds per 100,000, I think this was an NPR report a couple of weeks ago. I was quite struck by that, too. That showed 6 ICU beds per 100,000. We have a population of 275,000 in the county. So that's probably a low estimate, and I think that I'm not sure where that number came from. I tried to research this, and I think it had to do with licensed beds at the time. The latest data that this source came from was, I believe, 2014. So it's a little bit dated, that data, and not completely accurate. But that said, relative to other places, we do have fewer ICU beds. And some of this, I think, has to do, quite frankly, it would be nice to have more here, but it was largely the right number for normal times here. And there are other parts of the country that have far more ICU beds. It doesn't mean that those beds were appropriately used. So it's, market forces, it's all kinds of different issues related to that. So that is, I think, kind of the issue as far as that goes. Now, as far as
before you get to the second question, Doctor, on a regular month-to-month basis, are we in danger of running out of ICU beds normally?
No, it typically doesn't happen. I'm not aware of that. There are occasions when one ICU at the hospital may be full for different reasons. Sometimes it's due to staffing. Sometimes it has to do with the particulars of the patient, and they may need care at a different hospital because of the availability of specialty care that might be available elsewhere. But typically speaking, we do not have a normal shortage of ICU beds in the county.
Great. And we don't have a trauma center, right? Because we don't have since we don't have a trauma center, that's usually a place where you also have more beds. For a trauma case, that goes outside the county, correct?
That's right. Trauma cases go outside the county. It takes quite a bit of investment to have a trauma center, and we just really don't have the population to support it, especially when we have 4 other trauma centers within 30 miles. So it doesn't probably make sense to try to spool up another trauma center and kind of dilute that expertise. It's better if the existing trauma centers are busier, if you will, so that experience is consolidated into few specialty centers. So that's probably part of the reason as well.
There was another question about smoke and its role in the coronavirus.
Yeah, thank you. So the wood smoke, we don't have any guidance on that. I think that the presence of pollution in general can, and I have to admit I haven't read any studies on this, but I can tell you generally as a physician that the presence of pollutants in the air do weaken your immune system. They can cause some chronic lung disease that may make you more susceptible to the effects of the virus. And that's probably more of an effect. I think occasionally smelling smoke itself is probably not going to be a big issue, but being in a polluted environment, like I sort of imagine, like the pictures you've seen from Beijing or, environments like that where you're chronically exposed to airborne pollutants like that could lower your resistance to viruses in general.
Great. Thank you very much. Remember, you can ask a question by hitting star 41. Star 41. Let's see someone out there who has a question.
Hi. Can you hear me?
Yes.
Thank you. I have read that the number of positive tests depends on the level that is set for the polymerase chain reaction results, the PRC. What level is, I think our tests are all coming now from Santa Clara County. What number is Santa Clara County using for their PRC to determine a positive for COVID-19?
Yeah, that's a great question. I don't have a number to give you, but the 80 test has a certain sensitivity, and it does require a threshold amount of virus to be detectable on a test. And so one of the issues that often comes up is whether asymptomatic patients or people should be tested. And one of the problems with people that are not really experiencing symptoms, and by the way, we think that there is some prevalence of asymptomatic carriers out there. It's anywhere between, say, 6 and 11%. The best studies that we can find that look at this, that people that have no symptoms that are actually carrying enough virus to infect somebody else. That's one of the things that makes this such a tough virus to deal with, unlike MERS or SARS and before, which only symptomatic people were passing it on. But that said, if one were to test somebody who were having no symptoms and you got a negative result, that negative result could mean two things. It could mean that, A, they don't have the infection at all, which is what we would like to see, or it could mean that the infection is at such a low level that they're not producing enough virus that the polymerase chain reaction, the PCR test, could detect it. So that is something that concerns me and concerns Dr. Newell, is that testing of asymptomatic people could result in a lot of false negative tests and provide a kind of false reassurance that they actually are not carrying the virus when in fact they really are. That, in my mind, could be more harmful than just presuming that everybody is carrying the virus and that you take the appropriate precautions associated with that.
Becky, I know you had a third question, and I'll let you ask it now.
Hold on. Let me... There we go, Becky.
Oh, thank you. I appreciate that very much. I'm wondering about what people can do to boost their immune systems. That's a big piece of all of this. If your immune system is strong, you are less likely to have such devastating health impacts. Can you talk about that a bit?
Absolutely. I think that's super important, and that really comes down to the basics of getting plenty of sleep and rest, getting some regular exercise, and proper nutrition are all very important. If you happen to be somebody who has some pre-existing conditions like diabetes, we know that good diabetes control is very important. Some of the ICU cases that we've dealt with in the county involved patients with diabetes, and we know that that's a big risk factor. All of the patients that got really sick had poorly controlled diabetes. So that comes down to diet and exercise and following your physician's advice in terms of managing that. So boosting the immune system, there isn't really any magic pill or vitamin to do that. It really comes down to kind of the simple stuff of taking care of yourself.
Thanks. Well, we have a couple more questions. Why don't we try to get to them before the end of the hour?
Hey, I just heard my audio is on silence. Am I on again?
Yes.
I have another question. And
I want to make sure to get the other folks.
Ventilators.
Becky, let's see if we can get some other folks in here.
Okay, I was on.
So there's another wireless caller. Last number is 3724.
Yes, I have a question. Testing seems to be a real problem. How many tests are we going to need to perform every week or day here in the county so that we know it's safe to go out and can stop sheltering in place? And when do you think we're going to get those tests, and why haven't we ramped up and done more?
Yeah, great question. Thank you. The time for robust testing was in February, maybe even in January. And a quick story, you may know this, but the WHO had produced a test that most countries are using. 60 countries adopted it. The Centers for Disease Control developed their own test and distributed that on a limited basis with very strict criteria on who would be tested. It had like a travel question. You had to have symptoms. If you didn't meet the travel question, you didn't get tested. And unfortunately, that CDC test had a faulty reagent that made the results unreliable. That test had to be recalled, and that problem wasn't fixed for nearly a month. And so we lost some precious time early on as far as testing goes. Now we're in a situation where testing, there are efforts to ramp up testing, and I can tell you that we were relying initially on the Santa Clara Public Health Lab for all of our testing. They were gracious enough to accept our tests that we sent over to them, but they had limited capacity as well. And of course, you know the outbreak going on over there. We have built some local capacity here, Dominican, PAMF, and even our county clinics have purchased machines and have the ability to do some testing here in county. There's also some commercial labs that have been offering this, although they were so inundated that they had turnaround times of over a week, and it became kind of not very helpful from that perspective. So capacity is slowly building. I'll share a quick story with you. had purchased some machines in our county clinics, testing machine, and then we ordered some supplies for that machine. The order was rerouted before they even got to us. And the manufacturer is telling us that they are prioritizing more populous counties or larger orders first. So we're kind of a little bit far down on the pecking order and are doing our best to get the testing supplies ramped up. The second part of this is how do we know when we have enough testing, when is it safe to maybe relax some of the restrictions that we're currently doing? And that's a question that we're actively asking right now. We're looking at what does this look like a month or two from now after the peak? How do we know when it's safe to relax restrictions? And how do we know when some restrictions may have to come back on? And I call this kind of the hammer and the dance. Right now we're sort of in the hammer phase that public health measures, the social distancing, the facial coverings, et cetera, are the only tool we really have to control the spread of this at this point. And that later on, we are going to rely on understanding how much virus is in the area. When we do have positive cases, those require aggressive case contact. That means knowing quickly that it's a person is positive, and it means reaching out to everybody they might be near to do quarantine of them as well and to check for illness there. So that dance part of the phase is going to be coming up probably in the next few months, and that will have to rely on a more robust testing platform than we currently have.
Great. So we have a couple more questions. We want to try to get to them before the end of the hour.
Okay. I'd like to ask a question.
Sure. What's your name? What's your question?
Oh, this is Johanna, and I'm asking about masks. The thing in the newspaper keeps saying that you can only donate masks to the county if they're in unopened boxes. So I mailed the masks I had in an opened box to a nurse in Santa Rosa, and I felt kind of stupid going through these steps to unload N95 masks. Why do you insist, if people own a box of masks, they've opened it because they probably took 2 on a trip. Why is this county insisting that they be in unopened boxes before you can give them away?
Yeah, thank you. I'm not aware of that policy, but my presumption is that if the box is closed, then we have more assurance that the masks themselves are not somehow contaminated. And so that's probably the rationale, but I think given the situation we're in, we should relook at that policy, and I'll reach out to the people who are involved in that.
And I'll try to get back to you, Joanna, and when we get some answers from that. So I appreciate the question. Let's try to get 1 or 2 more questions in here. If you could unmute someone. Good evening.
Good evening, Supervisor Leopold. Doctor, thank you for this time. I'm joining the call a little bit late. Did you give information on how many COVID patients we're going to be able to take care of here in the county if we get a surge?
We haven't talked about that.
Yeah, we did. And just briefly, we think that we have enough hospital beds. We're concerned about the level or the number of ICU or ventilator beds at this point.
So he was asking, do we know what that number is?
We think my best estimate right now is we probably have about 400 hospital beds available at surge, and that the projections right now, some of the state models are saying that we could have as many as 300 or even 400 patients at peak that need to be hospitalized. The more concerning number is a projection of about 100 ventilated patients or ICU patients at peak, where we only have capacity for a little bit less than 50.
Yeah, this is just a good reminder for everyone that the more you do in keeping physical distance and sheltering in place, washing your hands, wearing masks, will mean that that we continue to flatten this curve, which makes it easier for us to meet the need in our community. So the community plays a role in the availability of these resources down the line. So everybody plays a role in that. The doctor will care for somebody when he gets there, but we control, in part, how many people will actually be there. I want to thank Dr. Ghilarducci for being here and answering questions tonight. I really appreciate that. You're doing great work every day, all day. I know that you don't get time off this. You probably haven't gotten time off in a while. This emergency medical planning becomes very, very important. If we didn't get to your questions, please feel free to email me, and I will try to answer those questions. And next Wednesday night, I'll have Sheriff Jim Hart on the telephone for us to talk about some of the issues, both related to the COVID-19 crisis as well as any other law enforcement issues. Thanks again, Doctor. I really appreciate you being here this evening, and thanks for everyone else who listened in tonight.
Thank you.